So, if you're in Quebec, this one's like really important. There's Bill 106 that Legault is trying to push through, which he says is going to improve access to healthcare. How is he going to improve access to healthcare, you ask? Well, he's got a couple of magic solutions. He's going to make sure that family doctors actually start taking patients on, because, right now it's just up to them how many patients they take on. How many patients do they choose to take on, you ask? About 770 patients per doctor on average, which means that on average, if your doctor sees you twice per year at half an hour each, that's about half the year. Like, he's got about 2 hours per year per patient. End of story. That's a full-time year. That's it. That doesn't include writing notes or anything. So as soon as you start factoring in notes, no. He can see you twice for half an hour each time. You better not have anything going on with you that requires more than half an hour's worth of work. Also, you know how specialists are just really lazy, right? I mean, these people only get paid when they do work because they get paid by the medical act, not per hour or anything. So why would they even want to do more work, right? Well, he wants to get them to stop working only 9 to 10 hour days and start working 12-hour days instead. And he's going to cut their pay 15% for the privilege. You know how, whenever you go to your boss, right, you're like, hey, could I please have 33% more hours and 15% less pay? No, I would quit my job if that was the case, especially if that 15% was like $75,000 a year. Yeah, maybe I'd quit. Because, of course, anybody would quit. But it's actually not a 15% pay cut. Don't worry. He's got a plan. It's actually that 15% of their pay is going to be attached to these objectives that they have to achieve. What kind of objectives? Impossible ones. He has deliberately set impossible objectives. Well, not technically impossible. If they can stop caring about patient health and just strictly start caring about their paychecks and start letting people die in mass numbers, they can still get their full paycheck. Check this out. So, he wants them to see 90% of patients who get into the 80% of patients who get into the emergency room within 90 minutes. It's an emergency room. People go in there for emergencies. Go figure, right? And do you know how the ranking system works? Real quick, right? Okay, so if you're a level 1, you're dead. That's basically it. You're dead and you need to be revived. If you're a level 2, it means that if they don't see you quickly, you're gonna be dead, because your situation's getting worse. If you're a level 3, it means that your situation's not getting worse. You do need to be seen, but if you wait longer, you're not going to get sicker or worse or risk dying because you waited. So there you go. If you're a level 4, it's kind of okay if you just come back or take an appointment elsewhere. And if you're a level 5, you've got a man cold. That's basically what a level 5 is. I'm sorry, it's a prescription renewal. That's what a level 5 is. You're not actually in harm's way in any capacity. So, if I show up in the emergency room with a broken arm, damn, that sucks, right? That's a level 3, because my situation's not getting any worse, but I definitely need to be seen. If somebody shows up and they're bleeding out actively, that's a level 2. Because, well, I can wait 8 hours with a broken arm. If they're bleeding for 8 hours, they're going to be dead. So they go ahead of me, even if I've been there for longer. Go figure. The person bleeding from the neck goes first before the broken arm. And if somebody shows up and their heart is not currently beating, they go before the guy with the bleeding neck, because they're already dead. They need to be revived now. And that's how priority works. What Legault has as an objective is that somebody arrives with a stopped heart and they go, Yeah, but I mean, like, their heart's already stopped. And if they just, like, die right now, then they don't count toward the 90 minutes. Meanwhile, she's been here for 85 minutes with her broken arm. So we've got to take her on right now, or we're going to lose $75,000 a year each. Meanwhile, you with the bleeding carotid, you just sit there and bleed for a little bit while we do her x-rays, okay? Because otherwise we're going to lose $75,000 a year each. And that's Legault's plan, to get people through faster. One of them's dead, one of them's probably going to die, but I got my x-rays. Doesn't that feel great? No. Ow, ew, awful, right? Okay, so let's try this. 4 hours, average duration in the emergency room for people who walked in there by themselves. 14 hours on average for people who arrived on a stretcher. If you arrived on a stretcher, you arrived by ambulance, something is very, very wrong with you. And Legault wants doctors looking at their watch and kicking you out after 14 hours, not after you're better. After 14 hours, or it's going to cost them $75,000 a year each. That's what he's going to charge them if they don't kick you out on the street, whether you're better or not, after 14 hours. That's just what it is. And he wants them checking their watch against their paycheck. Let's try just one more objective for the fun of it. 99% of consultations with a specialist done within 12 months. Great. That'd be great, right? Like, I've waited so long for an allergologist. Ugh. Really awful to, like, carry an EpiPen around with me for years. And I've got it, like, right here somewhere. Really awful to carry an EpiPen around with me for years and not fully know what I'm allergic to. But guess what? I'm an adult. I can manage my diet. I can manage my risks. I can even call 911 all on my own. But here's the plan. Let's say you've got a little 4 or 5-year-old, whatever, right? Who's had 4 anaphylactic reactions in the past couple of years. They've ended up in the hospital every time on an ambulance, and they could end up dead really, really quickly, and you don't even know why. You don't know what they're allergic to. Well, if I've been on that waiting list for 11 months, guess who's going first? Me. The adult who can manage her own life and her own food and everything. Not your little 4 or 5-year-old. It's okay if your 4 or 5-year-old waits to see an allergologist. They might die or whatever, but I mean, if they don't see me first, they're going to lose $75,000 a year each. That's how that prioritization is going to happen. But don't worry. If you thought that Legault was only going to end the lives of specialist patients, he's got more in store for you. So, he wants doctors, family doctors, everyone, to prioritize people based on age. People who are 70 to 75 years old or older than 75 are going to have different levels of priority. And doctors are going to get paid more for prioritizing them. So, let's say you've got a stage 3 cancer, but you're 69 years old. Well, somebody with a stage 2 cancer who's 70 years old is worth more money than you for the doctor. So they're going to go first if Legault's plan is followed. Doctors are not going to do that. Doctors are reasonable people and they care about their patient's health. They're not actually going to do that. But if they choose to prioritize your stage 3 cancer instead of this person who's 1 year older than you but has a stage 2 cancer, they're going to, if they're making those choices, they're going to be losing tens of thousands of dollars a year. And that's Legault's plan. He wants to bribe doctors to take on patients with less urgent medical needs based purely on their age, because his main voting demographic is boomers. So he wants to prioritize the boomers medically, and he's trying to bribe the doctors to do it for him. That's the plan. But don't worry, he's improving access to healthcare, right? If you're old enough, or if you've just been there long enough, then he's improving access. If you just need a doctor, no, that's not the priority. Sorry, sweetie. That's not how it works. But he says he's going to hire. He's going to not hire, but like he's going to create space for 500 more nurses. 500 more nurses. Nurses don't have a problem finding a job, sweetie. That's not why we don't have enough nurses. We have nurse shortages. So instead of having like 1,000 nurses missing, we're now going to have 1,500 nurses missing. Yay! It's not going to fix anything because 43% of nurses leave the profession within 2 years. So 43% of the money the government puts into training nurses, they're actually putting into training former nurses because that's what they become within 2 years. It isn't that there isn't enough space for nurses to find jobs. Nurses don't have trouble finding jobs. It's that they don't want the jobs because the jobs suck. They're really bad jobs, and conditions in healthcare are not. He's not planning to improve those. He just wants to create 500 more spaces for nurses who don't exist. Because it sounds good. 500 is a good number. I mean, it's like a drop in the bucket. 500 in a province of 9 million, that's nothing. But it sounds like a big number. 500, right? So many 500. And that's Bill 106. We're going to pay doctors less. We're going to overwork them. We're going to bribe them to prioritize people based on arbitrary objectives that are impossible to hit instead of basing it on, actual patient need. Also, we're going to pay every doctor less if some doctors choose to teach future doctors. And why don't doctors want to teach future doctors? We're just threatening to pay everybody less if they do. Oops. So yeah. Anyways, welcome to Quebec. That's your government. Have fun with it.